Why crown transplant is so tricky and technique sensitive. Hi guys, morning. When it comes to hair transplant, though techniques remain same, but when it comes to planning for transplantation, it varies with the frontal area transplantation different, temple angle transplantation different, crown area transplantation different. Well, we'll talk about crown or vertex area transplantation today. Why crown transplant is technique sensitive or why it is so tricky? Because most of the patient understood that crown transplant means don't go for crown transplant, it doesn't help. Some doctors would say don't consider doing transplant in the crown because it doesn't grow. Why do they say this? Well, there are a few reasons why crown transplantation is technique sensitive and tricky. Basically, because of the crown anatomy itself and pattern of the hair growth there and aesthetic challenges while doing transplantation. These are the few factors that determines the crown transplant results. Crown typically features a natural swirl and a wall pattern. While doing transplantation, mimicking or creating such kind of a natural swirl quite challenging for surgeon. And in such scenarios, sometimes you will have a double swirl. It's more challenging for surgeon. It requires high demand of surgical precision and planning. A poor design, poor planning for a crown transplant would always lead to unacceptable results or not blending to the native hair. Another important point in the crown transplant is angles and direction of the hair. Fortunately and unfortunately, when compared to the front side we have only forward angulations. When it comes to the crown typically have many angulations. Hair will grow in different angles and different directions. That's where we need to create or follow the natural existing hair angles to create the natural kind of swirl to achieve a visible density. Furthermore, a lower visual density. Because crown has a larger surface area and the way light hit on the scalp, it appears you get to see more skin than the hair. That also leads to kind of a poor outcome or poor results. In such scenarios, surgeons should plan and use the grafts very wisely without wasting the grafts. Otherwise, you are implanting in a priority area, and if it happens to lose further hair, the kind of you get island effect there. So that's the reason surgeon should also balance the grafts distribution very wisely to achieve best results in the crown. In rare cases, provided a very less donor area, we surgeons must limit their transplantation to only frontal hairline and mid scalp. In such cases, we cannot implant hair in the crown because of the lack of the donor area. So that's the kind of a wise plan to get some visual changes in the patient rather wasting the grafts in the crown. So these kind of calculations, it happens during the consultation by checking your donor availability and patient goals. But having said that, it's not impossible to do the crown transplant. We need to go with kind of a proper examination of the patient about donor availability. And there, if you have enough donor, we can definitely plan the crown transplant better. Basically, crown transplants demands artistic design, a high surgical precision, and a strategic plan of grafts usage. That means more efficient way how you're going to use the grafts would give you more density in the crown. Well, another point is usually someone is bald in the crown area would always need second session to enhance the density after 6 months or later. That's how we're going to get more density. At times, this patient, whatever we have shown you here, had done only one session, achieved above average density, which mimics like having a very good density. So all this can make less grafts, better benefit for the patient. Otherwise, the crown transplantation, just implanting like a frontal area transplantation would never give you best outcome. Only making the straight forward angulations in the crown would kind of give you awkward look. It doesn't blend to the natural hair. Most of the transplants I have seen that way. So once someone is follow the same swirl, same angulations and directions and strategic plan of using the efficient way of using the grafts in the crown would always give you a satisfactory change for you. That's all about the crown transplant. One should not worry about crown transplants at all. Crown transplants all also successful. Maybe you need more grafts, or maybe you need best surgeon to handle your crown transplant would always give you a very remarkable change in any given patient. Thank you.